Hello everyone, this is Dr. Neil, and a few days ago I did a question and answer session on my Instagram handle asking people what they want to know about the coronavirus situation, and I did get a lot of questions. So I decided, why don't I just club all of the questions together in a video and put it over here. This is a video about everything that people asked and also a few things that they didn't ask but should have. What are we going to talk about in this video? We're going to talk about its name, where it came from, what was the original source, how did it spread, how does it spread, how can you prevent yourself from getting it, what is the treatment, and for people in India, where can you get tested, and what is the current general situation of a country. So let's begin. What is it actually called? Basically, calling it coronavirus is correct and incorrect at the same time because coronavirus represents a group of viruses. It's not specific enough. Initially, we called it as novel coronavirus, which meant as a new strain of coronavirus, but now we have named it as COVID-19, coronavirus disease 19. A lot of thought was put into that. So if you want to be scientifically accurate, that's what you can call it. Well, if it is a novel coronavirus, where did it actually come from? So it went from humans to bats, and in bats it mutated and it went on to an animal called as pangolin, whose scales are supposed to have a lot of healing power. That's why it's trafficked a lot, and it ended up in the Wuhan market, wherein the spread of the virus happened and the discovery of the novel coronavirus was done. But in my personal opinion, I think it is too early to pinpoint the animals and the exact chain and the exact pathway that the virus took. Until all of this phases out, we won't be 100% sure as to what and where the virus actually came from. On to the next important topics. What are the symptoms of coronavirus? Well, remember three things in sequence: dry cough, followed by fever, followed by shortness of breath or breathing difficulties. Majority of the people affected by COVID-19 are going to exhibit just these three symptoms. But there are people who might progress onto a more severe form of coronavirus disease. These are people basically who are more than 60 years of age, have an underlying chronic condition, or people who are heavy smokers. They go on to something called as ARDS, acute respiratory distress syndrome, or they go into multi-organ failure, and that's how majority of the deaths of coronavirus have been happening. So stay alert, not anxious. What if you are showing the symptoms? Well, in India specifically, the government has set up 19 new test centers to test for COVID-19. Like in Delhi, you have AIIMS and Safdarjung. In Bombay, you have Kasturba. In Pune, you have Naidu and National Institute of Virology, so on and so forth, which you can research. The list is available on various government portals and websites. So if you do show these three symptoms, get checked immediately, maintain a safe distance from people, and avoid public places at all costs. How does the COVID-19 spread? Well, droplet infection, which basically is your respiratory secretions being ejected into the air when you cough or you sneeze. These can travel from around 2 to 5 meters on to an external surface from your body. How long does the virus survive outside the body is also a question that had been asked. Around 6 to 12 hours, a little more on metal surfaces such as lift buttons and metal phones or public places or railings and stuff like that. A little less on hotter surfaces. So 6 to 12 hours, give or take a few hours. After talking about the symptoms and the mode of transmission of COVID-19, let's talk about the treatment of COVID-19. Well, the treatment is actually supportive care. We don't really have a clear-cut medication as of today, 3rd March 2020, but there are a few medications such as favilavir or chloroquine, which is like an anti-malarial drug, which has shown a lot of positive results in the trials and on the patient who have coronavirus disease. So in time, we do hope to find a clear-cut drug for COVID-19. There's this English saying which goes as an ounce of prevention is equal to a pound of cure. So what are the preventive steps that we can take? Number one, hand washing. And by hand washing, I don't mean just put soap on your hand, do this, and put them under the water. By hand washing, I mean follow the proper steps of hand washing. Do this, then do this, lather them up, then do this, then do this, clean your fingers, then do this. Like the entire steps of washing your hands properly for around 3 to 5 minutes at least, and use a proper soap or an alcoholic based sanitizer. Remember that I told you that the virus stays in the atmosphere for longer when it is on a cold metal surface, like lift buttons and railings and stuff like that. Washing your hands disrupts this mode of transmission of virus to your body. Secondly, the T zone of your face. The T zone of your face is the mode of entry for the virus. The T zone represents this, and this. This basically forms a T. Yeah. So your eyes, your nose, and your mouth. Whenever you are in a public place, you touch a lot of different things. So avoid touching your mouth or your nose or your eyes with your hands until you've washed them properly for 3 to 5 minutes. Third one, masks. If you're in an outbreak area wherein the area has seen a lot of cases of coronavirus, wearing an N95 or an N99 mask might help in preventing the droplet infection that we initially talked about, but it's still a little controversial if it is effective or not effective. Number 4, keep a distance from people who have dry cough and are sneezing and do appear to be sweating a lot. Well, I think it has just started. We have seen an exponential increase in the number of cases in new countries reporting, which basically means that a lot of people who were in their incubation period have now started showing symptoms, and then have, because they were in their incubation period, they did not realize that they had the disease and now have spread it to other people who are right now in incubation period spreading the disease, who will show the symptoms in 2 to 14 days, but by that time they would have spread it to a lot of people, and it's an exponential cycle. So how long will it last? I don't know, maybe 6 months, a year, can't really tell. Well, the COVID-19 outbreak has now been named as a pandemic because it has reached 70 countries. So it has now become the fourth pandemic of modern times. We had the influenza, we had SARS, we had MERS. But that doesn't mean that you should be scared or really worried about it. See, our motto is to be watchful, not worried. We need to be alert, not anxious. How serious is this outbreak compared to the previous ones? Well, we had SARS and MERS, which were also from the coronavirus family, with a mortality rates. SARS was at 10%, MERS was at 34%. Then we also had Ebola, which is not from the coronavirus family, at upwards of 40%. Compared to them, COVID-19 sits at around 2 to 2.5%, which does not seem a lot, but the number of people who have died because of COVID-19 is much higher than those who had died because of SARS or MERS. But it's not about that. See, the thing is that COVID-19 comes from a family of coronavirus, which has given us SARS and MERS. But it has killed more people than both of those combined. The genetic mutation pattern is also the same. The animal reservoir of all the three was bats, and all the three got transmitted to humans because of unethical animal trade. See, we live in a time of superbugs. We have seen something happen in bacteria, that some of the bacteria have mutated genetically to a level that we don't have treatments or drugs that can treat those certain bacteria infections. Now that we are seeing a high genetic mutation rate in viruses that we haven't seen before, due to the same reasons that we keep committing, is this some kind of a warning? Maybe it is, but it's for you to think about.